Hello, we are at St. Elizabeth Healthcare in Northern Kentucky and would like to present a quick video in service on the selection and proper application of the Performax Total Face Mask made by Philips Respironics. The Performax Total Face Mask is designed to move the contact and sealing points away from the patient's nose and to the perimeter of the face where the surface is generally smoother, firmer, and more stable. The Performax allows a broader, quicker, and more tolerable application with one mask, as the patient's specific features related to their nose, mouth, and cheekbones are largely avoided. It is also the mask of choice in patients showing early signs of skin breakdown on or around the nose. The Performax may be used either continuously or as part of a mask rotation schedule to redistribute mask pressure and offload pressure applied to the nasal bridge. It is referred to as a total face mask because it encompasses the entire face, including the eyes. This design may also benefit claustrophobic patients due to preservation of the entire field of sight, thus improving tolerance and success of NIV in this population. The mask design also specifically directs gas flow over the mouth and nose, and there is little, if any, air flowing over the eyes as long as there is a good seal across the forehead. The Performax features a firm, soft silicone cushion that is designed to self-seal when it is pressurized. Additional features of the Performax include an exchangeable elbow system, 4-point head strap, and quick clip fasteners on the lower straps. It is important to inform and educate the patient about the mask and general goals of NIV therapy before applying the mask. It is helpful to describe the expectations and allow the patient to handle the mask prior to strapping it on and applying NIV. This helps the patient become engaged with the therapy and familiarize themselves with the many new sensations that they are about to experience, such as the feel, vision, and comfort of the mask. Give them a chance to ask any questions at this point. You will first want to determine the appropriate size Performax, which is available in either small adult or standard adult. A sizing gauge is included with the packaging. Be careful to apply the gauge correctly, as the wider portion of the gauge should cross the forehead. Make sure there is ample coverage around the corner of the eyes and that the bottom covers the lower lip completely. Now that you have selected the correct size, remove the mask from the packaging and apply it to the patient prior to connecting the circuit. Reconfirm the proper elbow is in place for current application. The Amber Leak 2 elbow is a vented elbow that allows adequate exhalation leak flow from the mask and should be used with single limb NIV circuits. The Leak 2 exhalation leak flow is higher than DEP and allows better CO2 clearance with masks that have a higher dead space volume, such as the Performax. The Blue Standard, or SE elbow, is non-vented and may be used with 2-limb circuits used on critical care ventilators. Please note that the clear Leak 1 elbow should not be used with the Performax mask. If you are using the V60, remember to set the mask port settings in the menu to match the Performax mask, which has a Leak 2 characteristic. To apply the Performax, first place the headgear behind the patient's head with the top cushion crossing the forehead. Confirm that there is adequate coverage around the corners of the eyes and around the sides and bottom of the mouth. Now tighten the top straps by pulling them both simultaneously and securing the Velcro ends. Next, secure the lower quick clips on the lower straps and lightly tighten the lower straps. Remember that the silicone cushion is designed to make the Performax a self-sealing mask, so once the mask is pressurized, the cushion should seal lightly against the patient's face. There should be ample room to place 1 or 2 fingers between both the upper and lower straps and the patient's head. We want any leak to come out the bottom of the mask near the patient's chin to avoid any leakage at the top that would result in air flowing over and around the eyes. We are now ready to connect the circuit and begin NIV therapy at low levels of pressure. Allow the patient to acclimate to the positive pressure and coach them through the first few breaths. Recheck the mask leak and provide any fine-tuning of the head straps to adjust the level or direction of the mask leak. Once the mask fit is customized to the patient, the Velcro tabs should not need to be adjusted again. Now you can titrate the pressures up to achieve the desired clinical effect or the physician-ordered settings. You may want to show the patient how to remove the mask by placing their finger behind the lower strap and pushing forward to unclip the lower fastener. Showing the nursing staff how to easily remove the mask using the lower clips will also ensure that the customized fit is maintained and they can easily remove the mask to provide oral care, give medication, sips of water, etc. Re-emphasize with the nurse that adequate and effective therapy may be delivered when there are leaks between 7 and 25 liters per minute around the mask. The Performax may be removed to allow the patient to eat or ambulate. In addition, it is recommended to remove the Performax in order to deliver medications by aerosol to avoid any medication exposure or contact with the eyes. Treatments may still be delivered with BiPaP using nebulizer modified with a mouthpiece. To conclude, let's briefly review the characteristics of the Performax Total Face Mask. It has a single-layer silicone cushion that allows a self-sealing application around the perimeter of the face, thus avoiding complications related to the nasal bridge and skin breakdown. It does not impede the patient's field of sight and may minimize claustrophobic effects, and it allows quick and easy application and removal. The Performax is available either as a vented mask with an amber 2 leak entrainment or EE elbow, or as a non-vented mask with a blue standard or SE elbow. The amber leak 2 elbow incorporates an anti-asphyxiation valve, provide enhanced exhalation flow from the mask elbow, and is easily identified by the orange packaging. This leak 2 elbow is designed for use with BiPaP devices using single limb circuits. The leak 2 elbow must be used with BiPaP devices, and it may be used in conjunction with a disposable expiratory port in the circuit. The blue SE elbow is easily identified by its blue packaging and presence of the blue elbow. The SE elbow is designed for use with critical care ventilators that have built-in safety valves and provide their own exhalation valve using a closed circuit. The Performax should not be used with a clear leak 1 elbow or a DEP in the circuit as the only expiratory port in the system. The Performax Total Face Mask has a higher internal dead space than a typical full face mask and requires a higher expiratory leak rate to provide adequate CO2 removal. In review, the Performax is designed to improve patient comfort and tolerance to NIV therapy with features that benefit a broader range of patients, including those with claustrophobia and those with early signs of skin breakdown on and around the nose. Thank you for your time and attention, and we wish you good luck and success in your future NIV endeavors using the Performax Total Face Mask.